Squish. Hello, Mr. Fu. My name is Ryan. I'm your nursing student today. I'll be conducting a head-to-toe assessment on you today. Is that okay?
Sounds good.
Great. Before we start, can I see your wristband? Tell me your name, date of birth.
Zachary Fung, January 8th, 2001.
Great. So, like I said, I'll be doing a head-to-toe assessment on you today. It'll require me to inspect, palpate, and auscultate from areas from your body system from head to toe. And I'll also be using I'll be also asking you to do some range of motion stuff, and I'll be adding some resistance to that to see what your muscle strength is. Is that okay?
Sounds good.
Great. At any point you feel any pain or weakness throughout this whole process, please let me know. We'll stop, let you gather yourself, and continue on when you're ready.
Okay.
All right. You ready to get started then?
Yep.
Okay. So just doing a general assessment on patient. Patient has upright body posture. He has a calm demeanor. He appears his stated age. He does not look like any pain, distress, or discomfort. And he has no signs of pallor or cyanosis. Okay? So, Mr. Floyd, the next thing I'm going to do is I'm going to ask you questions that are meant to help. I'm using to see your understand the situation.
Yep.
Okay? So, first of all, do you know who you are?
Yes, I'm Zachary Fung.
Okay. Do you know what today's date is?
November 30th.
All right. Do you know what or where you're at?
I'm at home.
Okay. Do you know why you're here?
I'm getting assessment from you.
All right. Great. Patient is A&O times 4. Okay. These next group of questions are meant to help guide my assessment. They're basic questions, so just answer them to your best ability, okay?
Okay.
So for your integumentary system, do you have any problems with your skin, hair, or nails?
No.
For your respiratory system, have you noticed any problems with your breathing?
Nope.
Okay. For your cardiovascular, cardiopulmonary, have you noticed any problems with your heart or your lungs?
No.
Okay. Have you had any tests done on your heart, such as an EKG or a stress test?
No.
Okay. For your GIGU, do you have any problems with your GI system?
No.
Okay. Have you ever had any abdominal surgeries?
No.
Okay. For your musculoskeletal system, have you had any accidents or trauma that have affected your bones, joints, or muscles?
No.
Okay. Has any muscle pain or weakness been a factor that affected your activities of daily living?
No.
Okay. For your nervous system, have you have any injury to your brain or spinal cord?
No.
Okay. And are you experiencing any numbness or tingling right now?
No.
Okay, great. So those are all my questions. Now we're going to go on to the actual assessment, okay?
Yeah.
So like I said, we're going to start from the head and go down to your toe and do every body system between there, okay?
Okay.
Great. So for your head, we're going to go can you smile? Can you puff out your cheeks? Show your teeth? Wrinkle your forehead? And can you raise your eyebrows? Great. So for this, I was assessing the patient's cranial nerve 7 or his facial nerve, which is intact, and his facial expressions were symmetrical. Okay? Next thing I'm going to do, Mr. Fuller, is I'm going to use my pen light here. I'm going to look at your pupils, okay?
Yeah.
Okay, great. For this, I was assessing the patient's ocular motor nerve or cranial nerve 3, which is intact. Patient's pupils were equal, round, reactive to light and accommodation. The next thing I'm going to ask you to do, Mr. Fuller, is can you just look at the tip of my pen light here and just move it up and down. Don't move your head. You're just going to be moving your eyes, okay?
Okay.
Great. Okay, great. So for this, I was assessing the patient's ocular motor nerve, trochlear and abducens, which is cranial nerves 3, 4, and 6, which were all intact. Patient's eye movements were smooth, rhythmical, parallel, and without nystagmus. Okay. Next thing, Mr. Fung, we're going to do is I'm going to go use my stethoscope to listen to your heart. Is it okay you remove your shirt?
Of course.
So I can listen?
Yep.
Thank you so much. Alright, so I'm just going to go listen to your heart. Alright, so the first spot I'm aiming for is your second intercostal space. Right sternal border, this is your aortic. S2 louder than S1, no extra heart sounds or murmurs, regular rate and rhythm. Alright, and I'm going to cross your sternum to your second intercostal space. Left sternal border, this is your pulmonic. S2 louder than S1, no extra heart sounds or murmurs, regular rate and rhythm. Okay, I'm going to go down one spot to your herbs point, which is your third intercostal space, left sternal border. S1 is equal to S2, no extra heart sounds or murmurs, regular rate and rhythm. Go down one more spot to your fourth intercostal space, left sternal border, this is your tricuspid. S1 louder than S2, no extra heart sounds or murmurs, regular rate and rhythm. Okay, now I'm going to go down to your fifth intercostal space, left midclavicular line. This is your mitral. S1 louder than S2, no extra harsh sounds or murmurs, regular rate and rhythm. Okay? So that's it for that. Your heart. Now I'm going to go on to your upper extremities, right? Can you hold them out? Great, and then rotate them. Great, and put them back. I'm going to palpate real quick.
Yeah.
Right. Feel any pain?
None.
How about anytime I go down further? Okay. And then hold your hand up. All right, great. So patient has no signs of pain or tenderness upon palpation of his upper extremities. He has appropriate pigmentation for his ethnicity. Skin is warm and dry to the touch. And no signs of erythema or edema can be noted. His upper extremities are symmetrical bilaterally, and capillary refill is less than 2 seconds. Okay? Now I'm going to go feel for your radial pulses, okay?
Okay.
You just hold them like this.
Okay.
Patient's radial pulses are 2 plus equal and bilateral. Okay, now I'm going to go look at your lower extremities. Okay, roll up your shorts a little bit. Yep. Thank you. Just going to do a quick inspection. Okay, I'm going to palpate real quick, okay?
Okay.
You feel any pain when I touch her?
Nope.
How about any point down here?
None.
Okay. Alright. Patient has no signs of pain or tenderness upon palpation of his lower extremities. Patient's skin is warm and dry to the touch. Even pigmentation. No signs of edema or erythema. His lower extremities are symmetrical bilaterally, and no signs, or capillary refill is less than 2 seconds as well. Okay. Now I'm gonna go feel for your dorsal pedal pulses.
Okay.
Okay. Patient's dorsalis pedal pulses are 2 plus equal and bilateral. Okay, so that's it for this area. If you want, Mr. Fung, the next thing I'm going to do is listen to your lungs using my stethoscope. Do you have any questions for me so far?
No.
No? Okay. So for this, I was just asking the questions, patient questions to distract him from, so he didn't realize I was looking at his breathing patterns. Patient's breathing appears relaxed, regular, unlabored, and spontaneous with no accessory muscle use. Okay? Now, Mr. Fung, I'm going to go listen to your lungs real quick.
Okay.
Anytime you feel my stethoscope touch your skin, please just take a deep breath, okay?
Okay.
Okay, so this is your right upper lobe. Great. Left upper lobe. Left upper lobe. Right upper lobe. Right lower lobe. Left lower lobe. Great. I'm going to do the same thing on your back, okay?
Okay.
Okay. This is your left upper lobe. Right upper lobe. Right upper lobe. Left lower lobe. Left lower lobe. Right lower lobe. Right lower lobe again. Left lower lobe. Okay, and then lift your arm. Right middle lobe. Great. All right, patient's lungs were clear to auscultation. No adventitious breath sounds can be heard. No wheezing, rhonchi, or crackles. Okay. If you want, you put your shirt back on, and then I'm going to ask you to lay back down. Okay. Okay. So for now, we're going to go look at your abdomen. I'm going to be looking at your abdomen.
Yeah.
Lay down. I'm going to roll up your shirt, okay?
Yep.
Great. All right. Patient's abdomen looks flat, non-distended. Umbilicus is midline. Even skin pigmentation. Patient's abdomen is symmetrical bilaterally. No signs of lesions, scarring, bruising, or erythema. And no obvious hernias or palpitations can be seen. Mr. Fung just let you know that when I do an assessment on an abdomen, I divide into quadrants right down the middle here and about right here. This is your right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay? With that in mind, I'm going to use my stethoscope to listen to your bowel sounds in each of those quadrants. Is that okay with you?
Yep.
All right, great. You just have to lay right there, okay?
Yeah.
Okay. Patient's bowel sounds are normal active. Okay. So, Mr. Fung, just to let you know that if I did not hear any bowel sounds, I would have to listen to each quadrant separately for at least 5 minutes to fully determine if your bowel sounds are truly absent. Okay?
Okay.
All right. But since I heard normal bowel sounds, we don't have to worry about that today. Okay.
Sounds good.
Great. Next thing I'm gonna do is I'm gonna go palpate your abdomen, lightly and deeply. Okay.
Okay.
Just let me know if you feel any pain. This is lightly. Okay.
None.
Here.
Nope. None. None. Nothing.
Okay. Now I'm gonna go a little bit deeper. Okay.
Okay.
This is a little bit deeper. Okay.
Yep. No. None. Nope. Nothing. 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 Nothing.
Okay. Great. Patient has no signs of pain or tenderness upon palpation, both lightly and deeply. No abnormal masses can be felt. Minimal rigidity and muscle tone is equal and bilateral. Okay. The next thing I'm gonna do, Mr. Fung, is if you can sit up, I'm gonna go tap your back real quick.
Got it.
And we'll rotate this way.
Got it.
Okay. Any pain?
Nope.
Okay. Other side.
None.
Okay. Great. No signs of pain or tenderness upon percussion of the patient's costovertebral angle. Okay. So the last thing we're gonna do, Mr. Fung, is I'm gonna go do some musculoskeletal. If you can stand right up. Just copy my movements. This is just to see your range of motion, okay? Shoulders, we're going to go flexion, back down for extension, abduction, adduction, great, 90 degrees, internal rotation, external rotation, and then we're going to go to, sit here, we're going to go flexion, extension of your elbows, and then supination, pronation, wrist flexion, wrist extension, ulnar deviation, radial deviation. For your hands, we have flexion, extension, abduction, adduction. Great. Patient has full range of motion of his upper extremities. His shoulders, elbows, wrists, and hands are all in alignment, symmetrical and bilateral. Okay. Next thing we're going to go is lower body. Just copy my moves again.
Okay.
Kick out for flexion, back down for extension, out for abduction, back in for adduction, internal rotation, external rotation. Great. Same thing for the other side. Flexion, back down for extension, abduction, adduction, internal rotation, external rotation. Great. Now for your knees, we're going to kick back, flexion, back down for extension, flexion, back down for extension. Great. Now for your ankles, we're going to go up on your heels for flexion and then press down through extension. All right. On the outside of your feet is inversion, and then on the inside of your feet is eversion. Great. Patient has full range of motion of his lower extremities, and his hips, knees, ankles, and feet are all in alignment and symmetrical and bilateral. Okay. Now I'm gonna go put some resistance on those movements. So just push against the resistance I put on. Okay.
Yeah.
So first of all, can you grab my hands? Push me away. Flexion. Great. Pull them back in. Extension. Great. Push out. Abduction. Back in. Abduction. Great. Rotate out. External rotation. Back in. Internal rotation. Great. Now try to flex, pull up. Flexion. Back down. Extension. Great. Hands. Alright, don't let me squish your fingers together. Great. Alright, and then squeeze my hands as tight as you can. Great. Patient's shoulder, elbow, and hand strength are 5 out of 5, equal and bilateral as well. Alright, so the next thing I'm going to do is muscle strength for your lower extremities, okay?
Yeah.
Try to kick out. Great. Back in. Kick out. Abduction. Back in for adduction. Okay. And then we'll do the same. Kick out for flexion. Back in for extension. Great. Out. Abduction. Back in. Adduction. Great. Try to kick back. Great. Back down. Extension. Kick back out. Flexion. And back down. Extension. Great. Push your foot up. Flexion. Press down. Extension. Up. Flexion. Down for extension. Great. Patient's hips, knees, and ankle strength are 5 out of 5, equal and bilateral as well. All right, Mr. Fung, that is all I have to do for you today. Do you have any questions before I head on now?
No.
No? All right, you have a great rest of the day then, too.
Yeah.
Squish.